الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Plague by Professor Mahmoud Hani Sulaiman. Epidemiology. General description. Geography. The principal endemic foci found in India, China, Manchuria, Mongolia, Burma, Vietnam, East Africa, Malagasy, Republic, Brazil, Bolivia, Peru, and Ecuador. Season. In temperate climates, plague is common in warmer months, summer, while in tropics it appears in colder months, winter. Causative agent. Name Yersinia pestis, plague Bacillus gram-negative. Yersinia pestis, plague Bacillus gram-negative. Resistance outside body, easily destroyed by disinfectants, heat and sunlight, but in cold or freezing conditions it can survive for weeks or months. Disease does not always confer immunity. Occurrence. Highly infectious disease plague now is not present in Egypt. Wild rodent plague exists in parts of USA, South America, Africa, Central and Southeast Asia. Human plague occurred recently in several countries in Africa and India. These are the places reported by WHO to have plague. It is denoted by circles. The space of circle is proportion to the number. This is 1 to 10, 11 to 100, 101 to 1000, more than 1000. Source of infection: animal wild rodents, rabbits and hares, and domestic cats. I believe owners of cats must know this. Domestic cats may also be a source of infection. Exit. Bubonic plague is not usually transmitted from person to person unless there is contact with pus from suppurating pupils. Pneumonic plague, highly communicable under favorable climatic conditions. Overcrowding facilitates transmission. Period of communicability: communicable as long as fleas remain infective. Fleas may remain infective for months. This is the flea, adult male, Diamnus montana flea, which carries Yersinia pestis. This is one type of rats which can carry flea, which carry Yersinia pestis. All wood rat species are quick to occupy and construct nests in human habitations or outbuildings within their range, so bringing vector fleas into close contact with humans and their pets. The pets can carry the flea or be bitten by the flea which carry the disease. This is a ground squirrel died due to plague infection with Yersinia pestis. Field rodents as western ground squirrels and prairie dogs may be a threat when their burrows are beside labor camps and residential areas. Labor camps, so it is occupational. Due to they and their fleas are carriers of plague bacteria. This is bobcat Felis rufus, can be a source of plague infection for humans. People involved in work, it is work-related, involved in trapping, skinning of wild carnivores, especially bobcats, should be extremely cautious about exposure to Yersinia pestis vectors. Host factors: those with occupation, which may expose them to rodents, may be at a higher risk for disease occurrence. Mode of transmission: transmitted from rodent to human by bite of an infected flea vector. Human to human transmission comes from inhalation of infected droplets spread by coughing patients with plague pneumonia, pneumonic plague, or pharyngitis. Transmitted also by handling tissues of infected animals. This sketch summarizes the method of transmission. It may be droplet infection, here in pneumonic plague. This is the enzootic cycle, and this is the epizootic cycle, and this is how the fleas found in these animals, cat, dog, rabbit, bite the human and cause bubonic plague. Portals of entry: nasopharynx, inhalation, skin through bites of infected flea. Incubation period usually 1 to 6 days. Diagnosis: clinical: acute severe infection appearing in bubonic or pneumonic form. Bubonic form: this is the most common form. Onset abrupt and associated with chills. Enlarged lymph nodes. Pupils appear with or shortly before fever. The most commonly involved lymph nodes are femoral or inguinal, followed by axillary and cervical. Nodes are tender, fair, fixed, and may suppurate in second week. Primary pneumonic plague: abrupt with high fever, tachycardia, and headache. Cough develops in 24 hours. Sputum is mucoid at first, then bright red and foamy. Chest X-ray shows rapidly progressing pneumonia. Secondary pneumonic plague occurs as a complication of bubonic plague due to septicemia with lung involvement. Method of diagnosis: presence of gram-negative organism on direct microscopic examination of a smear of clinical material. Examination by FA test is more specific and useful in sporadic cases. ELISA test permit early rapid diagnosis in acute cases. Diagnosis confirmed by culture of organism from blood, sputum, CSF, or lymph node aspirate. A fourfold rise in titer in a serological test, either passive hemagglutination or this is the most commonly. This is the Bacillus Yersinia pestis. This is hand of patient with plague displaying acral gangrene, a manifestation that may have given rise to the name Black Death. This is femoral and inguinal pupils in a boy showing marked edematous swelling, erythema, and overlying desquamation. This is axillary pupils with ulceration and small issue at the site of an infected flea bite. This is chest radiograph of patient with primary pneumonic plague. Anteroposterior X-ray shows bilateral progressive plague infection involve both lung fields. First signs of plague: fever, headache, weakness, and rapidly developing pneumonia with shortness of breath, chest pain, cough, and sometimes bloody or watery sputum, progressing in 4 days into respiratory failure and shock. This is photomicrograph of lung tissue from a fatal case of primary pneumonic plague and septicemic plague. Note filling of alveolar spaces with inflammatory cells and debris. Yersinia pestis as a bioweapon. It can be used as a bioweapon. Although it lacks environmental stability of anthrax, highly contagious nature and high mortality of plague lead to close to ideal agent of bioterrorism. In history, used as a biologic weapon by throwing of plague-infected corpus into enemy side. First noted in 1346 during assault of city of Kaffa by Tartars. Some believe that this event played a role in the start of Black Death pandemic in 14th and 15th centuries. So plague moved across Asia toward Europe at this time. During World War II, infamous Unit 731 of Japanese army reported to repeatedly drop plague-infested fleas over parts of China. These drops were associated with subsequent outbreaks of plague in targeted areas. Continued for this bioweapon, following World War II, US and Soviet Union made researches in aerosolized Yersinia pestis. Research at that time suggests that organisms remain viable for 1 hour, can be dispersed for 10 kilometers, while bioweapons program, it is believed that Soviet scientists did manufacture quantities sufficient for such a purpose. It is reported that more than 10 Soviet institutes, more than 1,000 scientists were working with plague as a biological weapon of concern. In 1995, a microbiologist in Ohio, USA, arrested for having obtained Yersinia pestis in mail from American type culture collection using a credit card and a false letterhead. In the wake of this incident, US Congress passed a law in 1997 requiring that anyone intending to send or receive any of 42 different agents that could potentially be used as bioweapons first register with CDC. Prevention to raise health promotion for healthy people to raise non-specific prevention, decrease likelihood of people being bitten by infected fleas or being exposed to pneumonic plague patients, educate public on importance of appropriate storing food to decrease rodent problem, avoiding flea bites by using insecticides and repellents, control rats on ships and docks in warehouses. Rat control must be preceded by flea control. Important. This is very important. Keep observation of natural foci by bacteriologic examination of sick or dead wild rodents and serologic examination wild and stray carnivores. Test fleas from wild rodents. Control of animal reservoir rodents. Control of wild rodents is neither predictable nor feasible. Commensal rodents can be controlled as follows: trapping of rats, cyano gas fumigation, and has disadvantage, sulfur dioxide fumigation. Please print and use this. Control of rodents. Continued use of DDT or BHC. Residual effect lasts for 3 to 6 months. Powders containing dilidrine or aldrine can be used. This helps to control rat fleas. Construction of rat-proof godowns. Construction of rat-proof godowns. Please print and use this. A specific prevention for healthy persons to raise specific resistance. Immunization. Active immunization with vaccine of killed bacteria will lead to protection for at least several months. 2 to 3 primary doses plus booster. This vaccine is used for people entering high incidence areas and lab or field works. It is an infectious disease. Handling plague, bacillus, or infected animals. Details will be given on coming slides. Chemoprophylaxis, tetracyclines. This is the details for the vaccine. Killed vaccine developed by Hafken. Formalin killed. Each milli contains 2,000 million killed Yersinia pestis bacilli. Primary course different between male and female. For adult male consists of 2 doses, 1 milli, 1.5 milli, interval for 2 weeks. For adult female, 0.75 milli and 1 milli for adult female, and less for children, but infants less than 6 months do not require vaccination. Vaccination after outbreak plague is useless, but during fear of outbreak. Say happen a break at Marsa Matruh, and we are fearing of this to happen in Alex. During fear of outbreak, at least 1 week before, only 1 dose, but with double dose. For male, it will be 3 ml. For adult male is recommended. Immunity develops after 1 week of inoculation and lasts for 6 months. Booster given in 6 months regularly for those who are at risk as geologists, biologists, and anthropologists. It is an occupational disease. Immunization also given to travelers to high endemic areas, 50% protective. Since the vaccine provides only tissue immunity, not humoral, it is not protective against pneumonic plague. Pregnancy is a contraindication because of its potential risk to lead to abortions or fetal damage. There is a vaccine, subunit vaccine under trials. There were tests in mice, but not yet in humans. Control to prevent spread from existing case control, early case finding, notify MOH and WHO, isolation, hospitalize patient for cases with bubonic plague if there are no respiratory symptoms, secretion, precautions indicated for 3 days after start of antibiotic, disinfection, use a safe insecticide to get rid patient, including clothing and packages of fleas. Disinfect sputum, purulent discharges, and soiled articles concurrently. Clean terminally. Handle bodies of plague victims with strict aseptic precautions. Effective treatment for patients with pneumonic plague. Isolate case to prevent airborne spread until end of 3 days of antibiotic therapy with clinical improvement. Use streptomycin tetracycline and chloramphenicol. These are the working group on civilian biodefense recommendations for the treatment of pneumonic plague. These are the recommendations for treatment of in detail. Please print and use. Contact control, observation, immunization, chemoprophylaxis, tetracycline. Contacts as source of infection should be investigated. Close contacts of confirmed or suspected plague pneumonia case should be offered chemoprophylaxis with tetracycline or sulfonamides, and these are the doses. Epidemic measure, intensify specific measures, investigate all possible plague deaths by autopsy and lab examination, inform public through press and news media, but avoid panic, destroy all rodents in affected areas after satisfactory flea control achieved, protect field workers against fleas by using insecticide powders and insect repellents. International measures. In 24 hours, government should notify WHO and adjacent countries of first cases of plague in any area previously free of disease according to international health regulations. Measures applicable to ships, aircrafts, land transport, and in travelers arriving from plague, specified in International Health Regulation 1969, 3rd annotated edition, 1983, WHO Geneva. Prior to departure from an area where there is epidemic of pulmonary plague, those suspected of exposure should be placed in isolation prior to departure, in isolation for 6 days after their last exposure. On arrival from suspected infected ship or aircraft, travelers should be disinfected and kept under surveillance for not more than 6 days from date of arrival. وفي النهاية أقول الحمد لله رب العالمين و thank you.